Love this little picture here with this little baby. It is a sad thing. I've got two little youngsters now at my house, so grandsons, and they go through that first little while of getting their bowel used to moving, and many times have a bit of constipation, and it's kind of sad when they get constipated and have to look like this as they're trying to pass their bowel. But a lot of people feel this way. As we'll learn here in a little while, it's almost 2% of the population suffers from significant, but I think it's even higher than that. As I ask patients about their bowel function, I would suggest more like 50% of the patients have constipation or at least abnormal bowel function. So we'll be talking about how to get that stabilized and working. So this is me. I'm a doctor of chiropractic. I've been specializing in natural and wellness for 23 years now here in Bountiful, Utah, just about 30 miles north of Inno-Vita. So what we need to do then is this is the example that I use every time I'm with a patient that has troubles, or just explaining to them how their bowel should function. I'll take a pen and I'll hold the pen with one hand, and with the other hand I'll bring my pinky and then my ring finger, the middle finger, and then pointer finger down the pen, and each one of those fingers would be representing that would be a meal or a snack or so forth. So if you think about it, as that meal comes in, let's say we eat at 7, and again at 12, and then at 5, and then at maybe a snack at 8 or whatever, that should be passing through our bowel and coming out within that day, because we're going to do the same thing the next day. So you think about it, we should have 3 to 4 bowel movements a day. And most people are saying, wait a minute. That's way too much. I would spend all my time in the bathroom. Well, that's where it should be. If you're putting that much in every day, that much should be coming out. And roughly every 4 to 6 hours, because that's the bolus, or the mouse and the snake idea, as it's producing, coming down through the digestive tract. So this right here on the note, some assume that if they go to the bathroom once a day, they are not constipated. However, if your stool is consistently hard, you may still be constipated. And I would say you are. If you're going once a day, that's constipation. Because as we learn here, there's more to it. There's transit time and toxins and so forth. So as we swallow, we do have a peristaltic wave coming right down our esophagus and ultimately into our stomach. The stomach then is going to churn that and turn this stomach contents into chyme. That chyme then, when it's to the right consistency, the pyloric sphincter will open, and we're now moving that chyme into the small intestine. So that peristalsis is so very important. So let's read this here a bit. Symmetrical contraction and relaxation of muscles in a wave that helps move food along the upper gastrointestinal tract. So there's 2 basic types: primary peristaltic wave. This occurs when we're swallowing, and then a secondary peristaltic wave. This is when that secondary wave, when the primary fails to move food far enough, then you get a secondary wave comes through. An example, so the earthworm uses a similar mechanism for movement. Earthworms, caterpillars, snakes, that same kind of concept to move things through. There's a condition or a reflex called the gastrocolic reflex or gastroiliac reflex. And this reflex triggers when the body knows that there's this sense of something inside. It's going to squeeze and move that bowel through the colon and the remaining digestive tract. The stomach stretches, causing a nervous impulse for the colon to contract, and then you have a normal bowel movement. So when you get something here into the stomach, it's going to sense, okay, we've got something here. We've just had a meal that's stretching. There's actually mechanoreceptors and chemoreceptors that signal to the nervous system that it's time then that the large intestine would start to contract. So as it's contracting, making more space for the next movement to come into. So that reflex is just so important. This was interesting. This is Marvin Gaye. I wish that being famous helped prevent me from being constipated. Interestingly, he said that. And he's probably on the road when he was out singing and so forth. Just didn't eat as good as he could. So most people eat 3 meals plus a snack daily between 4 and 6 hours apart. And because that peristaltic wave of the bowel, meals pass through the digestive tract about every 4 to 6 hours, a defecation. The elongated transit time gives toxins a greater chance to be absorbed into the system. So your normal bowel should be anywhere from 12 to 18 hours from eating to defecation. And so that's moving along, getting a good absorption of the nutrients and then passing that is not needed or roughage through, and along with the toxins. So that's very important. So bowel movements are indications of your gastrointestinal health. So if you're regular, 3 to 4 a day, that's great. But sometimes, you can have changes. So consistent or abnormal, sometimes you can get changes where you're more dried out, if you will, because of what you're eating. If you've had McDonald's, for example, or a fast food, then that's going to be most generally that'll cause some constipation or abnormal function. So making sure that we're eating more vegetable things will make it so that we're more regular. So when we look at consistency, if you're constipated, there's going to be small, separate, hard, and dry lumps, if you will. Clumpy, rocky, sausage-shaped with cracks, smooth or soft. Smooth or soft is where when we're seeing, that's how we'd like to see it. Smooth, soft, dehydrated enough so that, and I don't want to be gross here, but so that not much wiping is necessary. So it's not too sticky, if you will. But it's funny, sitting here asking or talking about it and thinking about talking to patients about it, and the questions that I ask, tell me about your bowel. Does it float? Is it really stinky? What color is it? Is it dark? You think about maybe possible bleeding and so forth. But it's so important what it does, the consistency and the shape and the overall coloring and everything. So then there's mushy and ragged edges, watery, not solid. So these are the things that the overall consistency, the overall thickness, what that looks like. Color, is it yellow to blackish brown? If it gets too dark, then you're thinking about possible bleeding ulcers. Had a lady in my neighborhood's sister-in-law was just taken off of life support on Sunday, and I would imagine she's now passed. But she passed out 4 or 5 days ago. Took her to the hospital. They couldn't figure out what was going on. Finally, they realized that she had a bleeding ulcer and had bled out and went brain dead. So she's there in the hospital. Her father-in-law comes up to see her and dies in the hospital of a massive coronary. So can you imagine being her husband, and now your father comes up to see her and dies right in the hospital of a massive coronary? I could not believe it. But thinking about ulcers and so forth, that's something that it's very rare that would happen. But I just couldn't believe that. Felt so bad for that the gentleman. This is an interesting slide here. This is an ancient Roman enema, clister. I guess that's how they did the enemas. So that's interesting. But the definition for constipation is from the Latin in 1400 AD, constipare, meaning to press or to crowd together. So just think about that. Even the way that a constipated feces would look as it's drying out, and you're going to get the haustra within the large intestine, that look, so it's going to be more marbly and kind of look like the colon would look as it's dehydrating. Now let me just back up here real quick. Constipation doesn't necessarily mean that it's dry and rocky. You can be constipated with sluggish, sticky material as well. So it doesn't always have to be the kind that's dried. So a condition then where there's difficulty in emptying the bowels, or which the bowel movements are infrequent or incomplete. Incomplete is also something to think about. People say, well, I have a movement, but I just don't feel like it's emptied enough. So that would be the incomplete part. So synonyms: costiveness, irregularity, dyschisnia. I don't know, I've never heard of that one. And sluggish bowels. So these are synonyms of constipation as well. So common causes: poor diet. So low fiber, processed foods. I'm not going to, I guess I already did say McDonald's earlier, but that looks like a double cheeseburger probably. Not that I eat it. I have been known to eat it occasionally. So, but what's interesting is if I do know that I'm going to have something that's not as good for me, then I'll always try to increase the amount of salad or roughage, vegetables, with it, and that seems to diminish the effect. It gives it more roughage so that it's able to pass the bowel more effectively. So low fiber processed foods and then not enough water, the liquids or dehydration. So that's a big one, and most of us don't drink enough water. Poor bowel habits, ignoring the urge to go. I know so many children that don't want to go to use the restroom at school, or oftentimes women are hesitant to use the restroom just because it's sometimes uncomfortable. So ignoring that urge. Now that urge should come within 45 minutes to an hour after you eat, that gastroiliac reflex. So that urge, go in and make sure that you pass your bowel. I'll also tell patients in the morning, as you're getting ready to take your shower, go down and just sit down on the toilet and do some contraction, and maybe even do some Kegel exercises where you contract the pelvic or the pelvic floor muscles, the pudendal muscles. These muscles, if you were going to urinate and stop your urine halfway, that would be a Kegel. But Kegel a little bit, and that'll wake up the bowel and let it know, oh, okay, I recognize there's some fecal material here to pass, so you can then go ahead and have one before you take your shower in the morning. And then, of course, then at lunchtime, dinner time, maybe before you go to bed. So it's sometimes not just I'm going to go to the bathroom because I feel the urge. It's bowel maintenance. Lack of exercise, not having enough movement, just being sedentary. Antibiotics, because of the amount of usually fungus that they create. Fungus is a big deal with constipation because the fungus has pseudopods, and these pseudopods will penetrate down into the colon and small intestine, and these pseudopods actually will penetrate deep into those tissues, and that kind of causes a paralysis or lack of peristaltic function. So the antibiotics will create that move the yeast into fungus. Low endocrine function, so hypothyroidism, uremia, hypercalcemia. This would be slowing metabolic processes. Also poor glycemic control. But the endocrine system, specifically with the thyroid, low thyroid, will also account for that too. Painkillers as aspirin, ibuprofen. It just, again, makes it so that it's kind of deadening it. Imbalanced vitamins, calcium, iron not properly balanced. So when you get too much iron, of course, causes constipation. And then laxative overuse. So Dulcolax, X-Lax, any of the laxatives. So laxative are stimulants that over time cause the body to be dependent. So we've got such a great answer for this. Common causes, the second idea, too much dairy. So realizing that dairy has 50 of the 70 phenols. A phenol is a 6-carbon ring. We studied it in chemistry. These phenols are what we interact with in our environment, and phenols are what makes you be allergic. But milk has 50 of the 70 known phenols, so that can really cause irritation. Antidepressants, so Prozac and the SSRIs, the selective serotonin reuptake inhibitors, that will affect the peristalsis because it needs serotonin. Depression, just a sluggish, low function. Antacids, so many people take antacids, and that's usually the problem with antacids, and the reason why they're having too much acidity is because they're not combining their foods appropriately. So carbohydrates and proteins don't digest well, so you get maldigestion. Causes gas, causes pressure on the pyloric sphincter, and now you've got, or not the pyloric, but the cardiac sphincter, and now you're causing GERD and regurgitation of stomach content. Not that you can taste it, but just enough that the acid is coming up and creating irritation. Now we take the antacids, now we've messed up our whole acidity, the acidic content, hydrochloric acid of the stomach. And without that, we're not digesting our proteins appropriately. Blood pressure and allergy meds. These are diuretics that can lower the blood pressure by flushing water from your system, which is needed to keep the stool soft. IBS and IBD, so inflammatory bowel disease. Crohn's and ulcerative colitis, that shuts it down. Again, these are usually layers of infection created. Childbirth, just just the pushing can stretch and overstimulate the colon. And then during child rearing or in utero, you're causing a lot of pressure, and many of the women will become constipated just because there's so much pressure from the baby being right close that it's hard for them to move the bowel. Diabetes and neurologic conditions like Parkinson's, MS, stroke, spinal injuries, all of this takes a large effect on the nerves of the colon. Aging. Most of our older age population that's one thing to talk about. How's the weather and how's your bowel function? Bowel function, I remember as my mom got a little older, she would talk mainly about how her bowels were functioning. Chronobiology, or changes in routines such as travel. So that, you say, I've got traveler's stomach or traveler's diarrhea, traveler's constipation, just because it's out of normal life. And then other diseases, lupus, scleroderma, amyloidosis, cancers, mainly due to commonly used medications and tumors. So that's some major causes. Statistics, prevalence. Constipation is the most common digestive complaint in the U.S., suggesting 4.4 million in the U.S. I would say it's even bigger than that. 1 in 61, or approximately 2% of the U.S. So these 4.4 million claim they are constipated most or all of the time. That's a lot. That's a lot of constipation. Most often were women, children, and adults over the age of 65. Also common are pregnant women, often as an issue following childbirth or other after surgery. And then 1.3 times more frequent in non-whites, thinking probably because of the amount of maybe pasta or things that are not as expensive to eat. So the quality of the food might be less, and then not enough vegetables to have fiber in the bowel. So that could be the reason of the non-whites. And then also more common in lower incomes than in higher. Again, that idea of not having enough to purchase good food. So the treatment steps, and this is what I find, is to recognize infections and remove them. We'll talk about what infections. Support the bowel and bowel tissues, reestablish good bacteria in the gut, and then replace digestive enzymes, and then work the diet. Specifically work the diet by increasing fruits and vegetables and water-soluble fiber foods. It's so important to have the vegetables and fruits. So I recommend patients do 50% veggies, 20% fruits. So that's 70% fruits and vegetables. And think about that. If everybody switched to that slowly and had more fruits and vegetables, this would be a non-issue. And then fiber increases the body's water content. So that's it's very, very important to have that. So it just softens it and makes it much more effective. So the formulas that we work with when we're working on supporting within the colon is Coltrax. So this supports the colon and the muscular wall of the colon in order to increase peristalsis. It also helps to repair the villi in absorbing the nutrients. So Coltrax works from the colon, I suggest from the mouth to the anus, or basically the whole digestive tract. So tremendous at repairing the tissue. Again, every time we're talking about an organ function with Inno-Vita, we're talking about DNA support, DNA repair. So you're repairing the DNA function so that it produces better cells, which produce better tissues, ultimately better organs. So that's the Coltrax. Next is the Digesta. This is digestive enzymes. Increases digestion by increasing the digestive enzymes. Also, biofilm is implicated in constipation. So biofilm is like a blanket in the colon, and it can often make it difficult for the body's own antibodies to function. So Lyme, one of the Lyme bacteria, or the Borrelia, creates its own biofilm. Biofilm is created by fungus. So it's just a mucousy blanket that penetrates, and Digesta helps to digest and remove this blanket. So if you're working with Lyme patients, or literally any patient, any malfunction in digestion, the Digesta not only was digesting the food that you're eating, but when taken on an empty stomach, even focuses more intensely on the biofilm and breaks that down. So now you're digesting that away so that now you can hit it with the other layers of infection. The good bacteria formulas, These help to reestablish the flora or the inner ecosystem. The ecosystem contains trillions of bacteria, estimated to be about 3 to 5 pounds of total body weight, but still outnumbers the human cells by 10 to 1. So imagine that. There's more bacteria in our gut than there are cells of our body. So it's so vital to have a good count of bacteria. 3 wonderful, tremendous, good reestablishing good bacteria. Prior to this last year, Leptera was what we had with Inno-Vita that had the good bacteria. This is our meal replacement. It's our basic general nutrition. I have it every morning for breakfast. I take 2 scoops of Leptera, and it's just tremendous. Today I had 2 scoops of Leptera and a scoop of Verdance, of which we'll talk about in a minute, and that was so tasty. So this is a good source of probiotic. All of the minerals and vitamins, digestive enzymes, proteins in the form of amino acids, and it's for our diabetic patients as well, as it is sugar. It's a sugar balancer, and then it's instantized rice protein, so it's a good source of protein. That's the Leptera. So this was our only source of good bacteria. But now Inno-Vita's brought on the fluorescein and the vivaprofen. I very much love the vivaprofen because it has the anti-inflammatory herbs that shut off the inflammation. Now, really recognizing that anytime we have any issue in the bowel, if it's leaky gut, if it's Crohn's, ulcerative colitis, irritable bowel, whatever, there's going to be inflammatory state. This is a great, great anti-inflammatory of the bowel, plus good bacteria. So then also we have the fluorescein, and it is more of just a good count of bacteria without the anti-inflammatory. So these are tremendous. I love these. As far as our secondary formulas, we have the Verdance that just came out in June. This is the greens and the veggies to provide health-promoting phytonutrients. So if you put Verdance along with IntegraCell, you have now created the best super antioxidant, super phytonutrient that there is in the world, period. That's my opinion. Because I know it's in IntegraCell, we're talking about per scoop 8,000 milligrams of type A antioxidant, not vitamin A, but type A. Type A antioxidant will knock out 1 million free radicals per milligram versus type B, which is 1 per 1. So 1 milligram will knock out 1 free radical. Okay, so if you've got 8,000 milligrams times 1 million, that's 80 billion free radicals that IntegraCell with 1 scoop will knock clear. So mix 1 scoop of an IntegraCell with 1 scoop of Verdance with a little bit of, I have another supplement company I use that's a good mineral liquid. This has a little bit of a sweet taste. I put those 3 things together, and for a mid-morning pick-me-up or a mid-afternoon pick-me-up, that's a tremendous 1-2 punch. You can't beat that as far as its ability for absorption and bioavailability is immense. And lastly, under the secondary formulas, hypothala, this helps to normalize irregularities in the chronobiology. So we're talking about hypothala is working with the hypothalamus that controls the overall endocrine function, which ultimately is what's in charge of your bowel function. So that's way good there. Now the treatment, when we're after layers of infection, in my practice, most bowel issues are created by fungus, parasites, and bacteria. But you want to check all layers of infection and be sure to treat the top priority infection first. So we've got Bacto-X, Meta-X, Bactos for bacteria, Meta for the metals and heavy metals and chemical, Microsite for microparasites. Again, microsite we treat for 40 days straight, where Paramac you do a 10-day cycle on and 5 days of rest with a minimum of 4 cycles or 2 months to knock out any larva or subsequent birthing, if you will, cycling. Fungex works with the fungus from yeast, then when it mutates out to fungus. So Fungex is a tremendous remover there. And EnviroX for virus. So I usually find that there's a layer of infection that we need to treat. And here's roughly as you can treat them. I usually use 1 4 times a day. 3 capsules a day at bedtime. But again, I want you to check, make sure you're doing your kinesiology to find out when the patient wants it, when their body wants it. If you have questions on how to use kinesiology, we've got a good video that you can watch. Call Inno-Vita and find out about that. So those are layers of infection, and you always want to make sure that you're working with the Coltrax and the Digesta at the same time as you're going to be working with the layer of infection. And then, of course, bring on the ibuprofen or the fluorescein. So go in after it, work with removing the infections, supporting the tissue with Coltrax, reestablishing the good bacteria with ibuprofen and fluorescein, and your digestive enzymes with Digesta.